Hello. You've probably heard about blood fat or high blood fat, especially if you or your loved ones have health concerns. I want to explain simply and briefly in this program what high blood fat means, how to find out if we have high blood fat, and what to do about it. If you want to know more about this topic, please stay with me. Firstly, we need to understand what blood fat means. And before that, we should note that fat plays a crucial role in our body's structure and provides energy. Therefore, we can't eliminate it from our diet. Instead, it's essential to control its amount. We shouldn't consume more than needed. So, someone with high blood fat has an excess of fat in their blood. Not that it shouldn't be there at all. So, what happens when it exceeds? When we consume food, its fat gets absorbed by the body. A portion is necessary. But if it's excessive, what does the body do with it? It starts depositing it, accumulating it in various parts of the body, whether in the abdomen, legs, leading us toward obesity, which itself becomes a platform for various diseases like high blood pressure, diabetes, and other physical problems. It leads us toward a fatty liver and sets the stage for cardiovascular diseases. These are the problems and consequences of high fat that we should avoid for our health. The second problem with excessive fat is that it leads us away from a balanced diet. We need proteins, carbohydrates, minerals, and vitamins found in vegetables, fruits, and fresh foods. If fat becomes predominant in our diet, we might not consume the necessary amount of proteins or vitamins. There are two terms: good fat and bad fat. Good fats are those that do not contribute to cardiovascular diseases, but still pose risks of accumulation, obesity, and its consequences. So, we should not consume as much of this type of fat as we want. It has a lower risk, lower damage, but still poses problems if consumed excessively. Good fats include fish oil, olive oil, pistachios, almonds, walnuts, or seeds like sesame and sunflower seeds, and dark chocolate. Bad fats, besides causing obesity, contribute to artery blockage and pave the way for cardiovascular diseases. Bad fats include red meat, palm oil, coconut oil, and processed foods where they use trans fats to increase their shelf life. Let me introduce two medical terms that might appear in your tests. HDL, referred to as happy for remembering the H stands for good fat, and LDL, termed as lazy for remembering the L stands for bad fat. How do we know if our blood fat is high? The precise and scientific way is through a blood test. Periodic tests show us the level of fat and how much it exceeds the normal range. Apart from that, you can consider the body mass index or BMI. There are tables available on the internet where you can see what weight range is considered normal for your height. If your weight exceeds that range, it means you've been consuming more food and fat than necessary. What should we do if our blood fat is high? If it's high enough to require medication, naturally, we should undergo tests. And based on the severity, the doctor will prescribe medication, whether alongside medication or if you haven't needed it yet. The best and most reliable solution is to consult a dietitian. Considering your personal characteristics like height, weight, age, and other factors, a dietitian will provide you with a specific diet plan. If you don't have access to a dietitian, the general solution is to minimize fat intake. Avoid excessive sugar intake, especially in beverages. And those consuming alcohol should be aware that it raises bad fat levels and should be avoided too. So, a healthy diet, exercise, and monitoring changes in blood fat levels are important. For instance, if your test shows higher fat levels than normal, test again after 3 months to see if your medications or actions have led to improvement or not. This way, you can adjust your actions accordingly.